Canine influenza, also known as dog flu, is a highly contagious respiratory disease that affects dogs. It is caused by a virus that specifically targets dogs. Just like the flu in humans, canine influenza can make dogs very sick. It's important for dog owners to understand this illness. We need to know how to protect our furry companions. Canine influenza was first identified in racing greyhounds in 2004. Since then, it has spread throughout the United States and other parts of the world. Outbreaks can occur anywhere dogs congregate. This includes dog parks, kennels, and grooming salons. Being aware of the risks and taking preventive measures is essential for all dog owners. By understanding canine influenza, we can help keep our furry friends healthy and happy. There are two main strains of canine influenza virus that affect dogs, H3N8 and H3N2. H3N8 was the first strain identified in dogs. It originated in horses and jumped species to dogs. This strain has been circulating in the dog population for over a decade. The H3N2 strain is a more recent emergence in dogs. It originated in birds and spread to dogs in Asia. H3N2 has caused several large outbreaks in the United States since 2015. Both strains can cause similar symptoms in dogs. However, H3N2 appears to be more easily spread. Canine influenza is highly contagious and spreads easily from dog to dog. The virus is primarily spread through respiratory droplets released when an infected dog coughs or sneezes. These droplets can travel up to 6 feet through the air. Direct contact with an infected dog can also transmit the virus. This includes touching the dog's nose, mouth, or eyes. The virus can also live on contaminated surfaces for up to 48 hours. This means your dog could pick it up from objects like food bowls, leashes, and toys. Even humans can carry the virus on their clothes or hands after contact with an infected dog. Mother dogs can also transmit the virus to their puppies. The symptoms of canine influenza can vary in severity. Some dogs may only show mild signs, while others can become seriously ill. The most common symptom is a persistent cough, which may sound like a goose honk. Other common symptoms include nasal discharge, lethargy, loss of appetite, and fever. Less common symptoms include difficulty breathing, eye discharge, and pneumonia. If you notice any of these symptoms in your dog, it's important to contact your veterinarian immediately. While many dogs experience mild symptoms, canine influenza can be a serious illness, especially for puppies, senior dogs, and those with underlying health conditions. In severe cases, the virus can lead to pneumonia, a serious lung infection. Pneumonia can be life-threatening, especially if not treated promptly. It's crucial to take your dog to the veterinarian if you suspect they have canine influenza. Early detection and treatment are key to preventing serious complications. There is no specific cure for canine influenza, but treatment aims to support your dog's immune system and manage the symptoms. Your veterinarian may prescribe medications to reduce fever-suppressed coughing and thin mucus. In severe cases, hospitalization may be necessary to provide oxygen therapy and intravenous fluids. At home, provide your dog with a comfortable and quiet place to rest. Encourage them to drink plenty of water to stay hydrated. Follow your veterinarian's instructions carefully and complete the full course of any prescribed medications. Vaccination is the most effective way to protect your dog from canine influenza. The canine influenza vaccine is a 2-dose series, given 2 to 4 weeks apart. Puppies need a booster shot at 1 year of age. Adult dogs generally need a booster annually. Talk to your veterinarian about whether the canine influenza vaccine is right for your dog. Vaccination is especially important for dogs who are frequently around other dogs, such as those who go to dog parks, groomers, or boarding facilities. In addition to vaccination, there are several things you can do to help protect your dog from canine influenza. Avoid contact with sick dogs. If you know a dog is sick, keep your dog away. Practice good hygiene. Wash your hands thoroughly after handling other dogs. Clean and disinfect contaminated surfaces. This includes your dog's toys, bedding, and food bowls. Consider limiting your dog's exposure to high-risk areas, especially during outbreaks. By taking these precautions, you can help reduce your dog's risk of contracting and spreading canine influenza. Canine influenza is a serious health concern for dogs, but by taking proactive measures, we can help protect our furry friends. Understanding the virus, its symptoms, and how it spreads is crucial for all dog owners. Vaccination is the most effective way to prevent canine influenza, and practicing good hygiene can help reduce the risk of transmission. Remember to monitor your dog for any signs of illness and contact your veterinarian immediately if you suspect your dog is sick. By staying vigilant and taking appropriate precautions, we can help keep our canine companions healthy and happy.